Tuesday, December 3rd, 2013. This is the Daily Rundown. I'm Chuck Todd. We got a lot going on, as we do every day in December. So let's start with my first reads of the morning, and it's on healthcare again. After the soft relaunch of the healthcare website over the weekend, the White House now feels that it's in good enough shape to do what they wanted to do 2 months ago: start a public campaign for the healthcare law overall. President Obama will kickstart the effort with an event at the White House this afternoon. Of course, this comes 9 weeks after the first rollout, which was marked by glitches and crashes, as well as repeated promises from the administration that things would get better.
Nobody's madder than me about the fact that the website isn't working as well as it should, which means it's going to get fixed.
No one ever imagined the volume of issues and problems that we've had, and we must fix it.
There is an enormous amount of work going on on a daily basis to make the necessary fixes and to upgrade the site with the goal of making it fully functional for the vast majority of users by the end of this month.
I am confident that by the time we look back on this next year, that people are going to say this is working well and it's helping a lot of people.
So after all that, the White House finally appears comfortable enough to say that the website is workable and workable enough to start promoting it. Late yesterday, it started with a tweet from healthcare.gov's Twitter account reporting that 750,000 people had visited the site on Monday. While it wasn't perfect, it didn't crash. And right now, that's good enough to get the sales campaign off the ground. When the president speaks today, you can expect him to return to a theme we first heard back when they tried to do this the first time in October.
Let me remind everybody that the Affordable Care Act is not just a website. It's much more.
Remember, the president has been pushing the Affordable Care Act for more than 3 years. As far back as the summer of 2010, he was touting early provisions of the law. And of course, he spent a good chunk of 2012 pitching it on the campaign trail. It's critical that the administration fix the politics of this, at least to the point where it's manageable for Democrats running in 2014. And to do that, the White House will have a coordinated campaign to emphasize the different benefits of the Affordable Care Act every day between now and December 23rd. It's the last day you can sign up in order to get insurance by January 1st. As part of the effort, President Obama will be sitting down for an exclusive interview with our own Chris Matthews on Thursday, December 5th. It's part of the Hardball College Tour. It will be live from American University and will air Thursday evening at 7 p.m. right here on MSNBC. In addition to the president's efforts, you're going to hear Senate Democratic leaders urging members to go on offense by collecting stories of people who have benefited from the law overall. Then there's what the DNC is going to do. They're launching an effort that they describe as a sustained campaign to promote the law. It'll include a website to push back against Republican criticism. For the GOP, they're trying to be critical to convince people that fixing the website doesn't necessarily fix the law itself.
People are going to find out their rates are going up. People that have insurance they like are going to be losing it. The individual market is pretty tiny compared to what's yet to come. And I think as that unfolds, this thing is going to be an unmitigated political disaster for the president.
Political issues aside, many consumers are going to be able to draw their own conclusions about how well healthcare.gov is working. Many problems apparently have been fixed, but not all of them. At one point Monday, customers were told there was too much traffic on the site, and they were given a link that they could use to try again later. At the time, just 35,000 users were on the site at one time, 15,000 less than the 50,000 people the site was supposed to be able to handle at any given moment. Another critical issue involves something called 834s. These are the enrollment data forms that are sent to insurers to let them know when new customers sign up. But many of these forms have had mistakes. The government says the problem has now been repaired.
The healthcare.gov team, working with issuers, determined that more than 80% of the 834 production errors were actually due to one bug that prevented a Social Security number from being included in the application. The lack of that number caused the system not to generate an 834. That bug has been fixed and is now working properly.